Good morning and good afternoon. Thank you very much for inviting WaterAid to participate to this very important webinar. I will now share some of WaterAid's approach during the COVID-19 response, in particular linked to rural water supply. So the main aim of WaterAid intervention in the COVID-19 response is to support and strengthen the efforts of the national and local governments in their response to the COVID-19 emergency, rather than creating an independent intervention. And therefore, we're very much working in coordination with the overall sector. What are WaterAid key interventions then? So in all WaterAid supported countries, we are scaling up our hygiene promotion work, in particularly focusing on hand washing with soap as a key preventative activity. We're also working on supplying touch-free hand washing facilities in both public spaces and health center facilities. Then, in addition to this, depending on the local context, capacity, resources and needs, we're also working on strengthening and improving the overall wash in health center facilities. Then we're working with the local service providers to assure wash services continuity, and also working to address inequalities and wash access for the most marginalized communities. So how are we delivering the support within WaterAid? Well, firstly, we're observing each country's government movement restriction and physical distancing guidances. We're working together in support of our local partners and also key workers, such as utility staff, local technicians, who are responsible to manage the essential services, such as water supply. We're adapting our response to the local context in terms of the current emergency status and situation, and also depending on the local capacity and resources of both the countries and WaterAid itself. But most importantly, we have introduced a phased approach to the response, with different activities in line with different phases of the emergencies. Firstly, in terms of preparation, mitigation, response, and also importantly, activities to continue wash system strengthening for the long term. So WaterAid's main immediate response intervention for COVID-19 emergencies has been to work in all WaterAid supported countries to scale up the existing hygiene interventions in coordination with the government. To do this, we have introduced a customized phased approach, which includes different activities based on the different context and different emergency situation. This includes the promotion of key hygiene behaviors with different types of material and means, particularly hand washing with soap, covering mouth, physical distancing, all in order to reduce the transmission risk. We have worked with local digital and mass media channels for the promotion of national campaigns, including Greggio and SMS. We have provided touch-free hand washing facilities in public locations such as markets, health center facilities, for example, the one you can see here from Bangladesh. We're also working and continue to work in support of government-led campaign for the sustaining the behavior change measures. Complementary to the hygiene intervention, we have identified 4 key main objectives of WaterAid's intervention related to water supply during the COVID-19 emergency. These include universal access, ensuring therefore that also poorly served households and healthcare facilities have sufficient water for basic needs, including hand washing and cleanliness. Secondly, ensuring continuity of the services. So really working with the service providers to ensure that water services can continue. There is minimal disruption, and in particularly promoting continuity of access to those low-income households. Thirdly, we're working on reducing risks, both of COVID-19 transmission during water services access, but also reducing conflict risks at the water point. Fourthly, within the long term, continue to work on system strengthening. We need to continue to work with local and national governments to ensure a stronger wash system in the long term. To achieve this 4 key objective, WaterAid's intervention on rural water supply during the COVID-19 emergencies is very much based on working with local service provider, local stakeholders, and national government. We have identified a range of possible areas of intervention that can be delivered together with the local partners. To coordinate and plan universal access, we can work with the governments and service providers by sharing and coordinating the service level data available to identify and prioritize areas which are poorly served. We can increase the availability of water supply service label data as well. To achieve the important objective of continuity of access, a number of activities can be put in place. Firstly, mobilizing resources for rapid rehabilitation of non-functional water points. Supporting a provision of emergency water supply, for example, with water tankers. Working with service providers, utilities, to ensure the water can be subsidized where needed. Supporting service providers to procure essential supplies such as chemicals and spare parts. Support the service providers to develop continuity and equity plans where these are not present. And finally, working also with energy providers to ensure that power supply can be continued, particularly in health center facilities. For reducing the risk of contamination, there's different ways of promoting ways to maintain physical distances at communal water facilities. We can include regulated queues, inclusion of space markers to keep distances during the queuing, inclusion of additional tanks and taps for collection of water, or including the presence of operators that can fill the containers instead of household. Promoting regular disinfection of services of water point. In addition, promoting water safety, water treatment and water storage at the household as a complementary measure. Throughout the pandemic period and following this, it's important to ensure that water collection, responsibility for the cleanliness, hygiene, water and sanitation facility is not just responsibility of women, but of all. And that there is information and there is management of violence, conflict and exploitation of the water source. Finally, for the long term, we need to continue working on system strengthening, so pushing for a strong WASH system to ensure the right leadership, governance, coordination, integrating finance and accountability and capacities are in place to deliver sustained inclusive services to all in the long term. Here are some examples of practical interventions that WaterAid has been delivering. In Ethiopia, we've been working with health center facilities which are responding to the COVID response to increase the water supply storage capacity to ensure water availability continues. In India, we have implemented some very simple physical distancing measures of water points. Nigeria has been working with the government to highlight the areas and regions which really need to expand rapidly WASH access, in particularly marginalized and poor communities. And across different countries, we're adapting different monitoring measures such as WASH Fit to the COVID settings. Finally, here are some links to different public documents on COVID-19 response by WaterAid. Thank you everyone for listening and look forward to the discussion.